Welcome to Black Women's Health, a podcast, a platform dedicated to promoting health and healing for Black women. I'm Dr. Rahman, and I am a board-certified OBGYN. Today, let's learn about the Kegel exercises and finding our way to a more sexually fulfilling life. Last week, I spoke about the pelvic floor muscles, a group of muscles that form a platform at the bottom of our pelvis to support the uterus, the bladder, and the rectum. And quite literally, the reason these organs, the uterus, the bladder, and the rectum, don't protrude and dangle between our legs is because of the pelvic floor muscles. When these muscles become weak after childbirth or after menopause, and we lose support, we can experience prolapse, incontinence, and difficulty with defecation. I know you may not have heard a lot about this in the news or even in your GYN office, but these problems are quite common, and many women don't know about the pelvic floor. And many women don't know about exercises for the pelvic floor muscles, i.e., the Kegel exercises. A bit of history. Kegel exercises were first introduced by Dr. Kegel, an OBGYN, in the 1940s. And while we've known about them, and back in 1940s, it was documented to help with urinary incontinence and enjoyment of sexual activity. Often, women did not know how to do these exercises properly. So let me start off by saying, if when you are doing your Kegel exercises, you are contracting your butt cheeks, these are not the muscles. Your butt cheeks are not the muscles that support the uterus, bladder, or rectum. If when you're trying to do a Kegel exercise, you are contracting your abdominal wall muscles, these muscles do not support the uterus, bladder, and rectum. There's a good probability that you're doing it right if you can imagine gripping a penis or a dildo and squeezing while in your vagina. Or you can imagine preventing the expulsion of gas or flatus, preventing a fart. Please excuse the expression if this is too graphic, but it's important for us to be able to identify the correct muscles. Or 3, if you can imagine stopping the flow of urine while keeping your butt cheeks and your abdominal walls, muscles relaxed. If you're not sure, this is the time to talk to your OBGYN, to demonstrate in the office and have him or her tell you if you are correctly identifying your pelvic floor muscles. Unfortunately, your gynecologist and or the GYN nurse practitioner may not be sure. And in that case, please do not hesitate to ask for a referral to a physical therapist who has been trained and can assist you in identifying and learning how to contract your pelvic floor muscles. It's just that important to be proactive, because it's a great preventative measure that could possibly keep you from avoiding surgery at a later date and time. So it is well worth your time and effort to learn how to enhance your sexual pleasure and contract your pelvic floor muscles. Learn how to take your vagina from being passive to dynamic. learn how to prevent urinary incontinence. And if you are someone who's starting to experience some slight urinary incontinence at this point, when you laugh or when you cough, try the following. Tighten the pelvic floor muscles first before you laugh, before you cough, and you may find that there will be no leakage. And this is great because you're exercising the muscles and you are preventing a potentially embarrassing moment. You can contract your pelvic floor muscles whenever you want to. Whether you're sitting at a red light or watching a commercial on TV, you can do it during sexual activity. You can do it whenever someone pisses you off, and no one would ever know. Make it a part of your daily activities. Learn to be proactive about your health and enjoy the enhanced sexual pleasure that you will experience. And like all other exercises, this will not be an immediate improvement. You will not see results immediately. It takes weeks. It takes doing it on a regular basis, and it takes doing it correctly. But it pays off. It's holistic. There aren't any negative side effects to learning how to contract your pelvic floor muscles. And there's a huge potential upside. And so this is Dr. Rahman saying, until the next time, take care and be well.